So far this year, a total of 6 cases of measles have been reported right here in Georgia. The last one coming last week, the patient is unvaccinated and part of the same Metro Atlanta household as the May case linked to travel abroad. Now, the infected person was placed under quarantine immediately after known exposure. The 6 cases this year matches the total logged all of last year. Here to help us make more sense of this is state epidemiologist Sherry Drensick. Sherry, welcome to the show.
Thank you for having me.
All right, let's start off with this latest case. How close was Georgia to having a broader outbreak, and what stopped that from spreading beyond the household?
Yeah, both of our measles situations this year have been very similar in that there were 3 cases in January and 3 cases in May that were all in the same households, and they were related to international travel. So what we do as far as our public health response, which is every measles case is an emergency for us in the sense that we right away find out where a measles case has been during the period that they're infectious, which is 4 days before their rash begins and 4 days after the rash starts. Every place where they've been, we identify people that may have been there, and we try to find out if any of these people are susceptible to measles. And if they are, that means either they're not vaccinated or they're too young to be vaccinated, or maybe they're immune compromised. So we identify all those people right away. We give them vaccine or immune globulin if it's appropriate, and that will stop them from becoming infected as well. And then for individuals that are kind of beyond that time frame, we actually monitor them every single day with an electronic system that we have in public health that goes through their entire incubation period through 21 days. And the most important thing we really try to reiterate to folks that may have been exposed to measles is that we don't want them to show up at their healthcare provider or an emergency department just on their own. We want to be able to facilitate that so it's safe and so it doesn't spread to others. So in our situation here in Georgia, our rapid, sort of response in sort of containing people that may have been exposed and monitoring them was successful, and we didn't have any other secondary cases, just the ones in those households. So in that sense, it's kind of a tried and true public health measure that we use for other communicable diseases as well. We call it contact tracing.
And so the risk, you have to be really close. Obviously, we had 3 cases in one family. That makes some sense, right? Because they're right there in the same household. So a neighbor, would that person be quarantined as well, or would you kind of contain them as well, or maybe a whole block?
No, you really do have to be, in physical proximity. Although measles is tremendously contagious in an environment where there is close proximity. For example, there have been measles cases that have spread on airplanes. So an individual who was incubating and infectious with measles actually spread to other individuals that were close by on an airplane. Measles virus can actually remain in the air or on surfaces for several hours. So if somebody with measles is in, let's just say, the waiting room of an emergency department,
right,
we actually identify all the people that were in the emergency department with them because, again, in this situation, it might be in the environment. So that's our usual way we do it. But if we're talking about a household and a neighborhood, it wouldn't be like that. We want to be really in physical proximity.
Yeah.
And really, the most important thing that we really try to reiterate is that people should be vaccinated, especially if they're traveling. The international travel and even domestic travel in some situations, this has been the driver of measles cases and measles outbreaks here in the U.S. this year, which is really turning out to be the largest number of measles cases in the U.S. Since 25 years, or since 2000.
What should we be looking for? Obviously, heightened concern about the travel piece. That really got my attention there. And maybe we need to think about how we, bring folks back in and checking them, that kind of thing. But what should we be looking for or looking out for when it comes to the measles?
Yeah, well, number one, I would say that the most important thing that we can do as not only individuals, families, and communities is to ensure that everyone is up to date on vaccination. Because there are so many measles cases now internationally and here in the US, we really recommend that anybody that's traveling needs to be vaccinated against measles with the MMR, 2 doses of MMR vaccine. It's safe, it's effective. And for infants that are too young to be vaccinated, usually they get their first dose at a year of age.
Yeah.
It's actually recommended now during this kind of ongoing measles situation here in the US that they get an early dose if they're traveling internationally. So if you have a baby that's under the year of age, they can get an early dose, and that's very important as well.
All right, Sherry Drinswick, thanks so much for joining us. Really appreciate your insight on this. We may be talking to you real soon, so stay with us.
Excellent.
Stay with us.
My pleasure.
Hopefully
Thanks
it
for
doesn't
having
spread,
me.
though. Hopefully it doesn't spread. Thanks so much.